Okay, so very good evening, students. Let me check. Yeah, a very good evening, Mahesh. Am I audible to all of you? Hello, Indran. Good evening, Mahesh. Yeah, I think I am audible. Yeah. So, very good evening, Mahesh, Indragni, Prachi, everyone. So, welcome to this half an hour session. It will be a half an hour packed session. We'll be taking MCQs on National Health Program, which is very important for when we are preparing for our exams. So, National Health Programs, it's very important to have a proper understanding of that. So, before I start, just as you know, we have iconic subscription. You can get the best of Unacademy, you can get the best of Prep Ladder by having live classes, batch courses, tests, quizzes. And in Prep Ladder, you can have video lectures, question banks, rapid revision courses, and all those. So, how can you go for the subscription? So, there is 12 months, 18 months, 24 months, 30, 36 months, and the prices are given. So, you can you can opt for all this, and so this iconic subscription is basically helping on means you can get benefit from Unacademy and Prep Ladder both. And the best part of Unacademy happens to be the live classes where you interact with the educators concurrently, tests, quizzes, batch courses, and structure schedules. So now coming to the first question, students, if you see under National Health Mission, which is a flagship program of Government of India, which committee is responsible for making plan for village health? So you have to just think under the NHM, which committee is responsible for making village health? Is it Panchayat Health Committee? Is it Village Health Planning and Management Committee? Or is it Village Health Sanitation Nutrition Committee or Rogi Kalyan Samiti, students? Just try this. We have started with an easy question. So under National Health Mission, which committee is responsible for making a plan for village health? So can I have answers? Mahesh, Indrani, Prachi. Okay. Yeah. Meg goes with B. Somebody is going with B. Rahul goes with A. Anyone else? Mahesh, Indrani, Prachi goes with D. Okay. Okay. Jelena goes with A. Many A. Now, students, you have to think in this way. We have National Health Mission. It has got two wings, as you all know. NRHM, which take care of rural part, and you have NUHM, which we have National Urban Health Mission. So what this is talking about, it's talking about village health. So the moment it talks about village health, students, so we can think of many things. You can think of Panchayati Health Committee, Planning Management Committee, Rogi Kalyan Samiti, but yeah, Mahesh is right. You think of village health committee, and when you are talking about village health committee, the important component happens to be health, sanitation, and nutrition, students. So always go with, whenever this question is asked, it is Village Health, Sanitation and Nutrition Committee. So this is a committee which take care of nutrition, which is N, sanitation, which is S, and definitely health. And it is at the village level, so it becomes Village Health, Sanitation, Nutrition Committee. So the answer becomes C. Okay. Now, what are the important, just see this picture and it makes us it becomes so easy to understand. You see all the village people are sitting. We have a Asha here, we have someone representative from Panchayat, and you see the pictures what they are doing. Now you see this is health, means treatment is going on at the facility. You see this is sanitation. You see this is sanitation. This is nutrition. So it is talking about village health, sanitation and nutrition committee. So this take care of the village health. Now just see students, just wait. Yeah, so you at the village level you have village health sanitation nutrition committee. At the district level, community health center and PHC, you have patient welfare committee, which we were called, which many of you have answered, Rogi Kalyan Samiti. So it is called patient welfare committee. At the district level you have district health committee, and the state level you have state health committee. So the question was related to village. Okay. Now what are the important points of that? That at every revenue village level there is a possibility of having a VHSNC, right? Always think health, sanitation, nutrition, and then village committee becomes easy. There can be minimum of 15 members, and members of panchayat can also participate, and workers who are working in health and health related services, they also participate, and Asha is the member secretary and convener of the committee students. And this VHSNC, an untied fund of rupees 10,000 is provided so that this money can be used for the village health component, nutrition component, sanitation component. So this is about VHSNC. Praveen is right. Funding is done through VHSNC. So it's important. There is a difference between, you must have also heard VHSND. It is Village Health Sanitation Nutrition Day, where your immunization, family planning, nutrition, sanitation day will be observed. But this is a committee. Okay. Great. Let's move to the second question. How many health conditions identified for screening under RBSK program? It is 30, it is 28, it is 34, it is 36 students. Try this. How many health conditions has been identified? Yes, Rajesh Sarkar is saying that VHSND is celebrated once in a month. Absolutely correct. How many health conditions just before you take this question and then I'll answer to that. VHSND is not a typical routine immunization session, students. Routine immunization session goes on. VHSND is beyond routine immunization. We have component of family planning, we have component of nutrition, we have component of sanitation also. Okay. Now taking this question, somebody is going with 34, somebody is going with 28, 30. Okay. But Varuna has gone with A. Okay. Now what is RBSK? First of all, it is important to understand what is RBSK. It is Rashtriya Bal Swasth Karyakram. So you are trying to ensure at the R means Rashtriya, national level, Bal means children. So Bal Swasth means health, the Swasth and there is a program. So we are trying to ensure that children health is in proper condition. So let's have a program which screens certain diseases. So that is called RBSK. Now it has got 30 diseases has been enlisted in this, which need to be screened by the RBSK team. Now when I say team, you have a medical officer, you have a paramedics, they go in the field and try to screen children with 4 Ds. As you all know, it is talking about 4D. Now, what are those 4 Ds, students? Birth defect, so this is 1D. Disease, this is 2nd D. Deficiencies and developmental delay and disability. So Rashtriya Bal Swasthya Karyakram through the screening program tries to screen 4Ds: defect, disease, deficiency, developmental delay. Now this is 4D. Now what are the conditions before that? Which is the target group? As I said, the name is what? RBSK, BAL. So it will be related to children. So we have divided, the program divides into 3 group students. Let's take from birth to 6 weeks. When I say birth to 6 weeks, babies who are born at public health facilities or home, they will be included in this. The second category is 6 weeks to 6 years. So you will find all preschool children in rural and urban slums. And then 6 to 18 years you will find in government and government aided school. So all from, you can see from birth till 18 years, these children are screened for 4D at different places. For example, facility, rural areas, government and government aided school. Now we have 30 diseases and it has been categorized into 4D. First you see defect at birth. When I say defect at birth, there are 9 diseases: neural tube defect, Down syndrome, cleft lip, palate, congenital cataract, deafness. So these are related to defect at birth. You have deficiencies, you have childhood diseases, and you have developmental delays and disabilities. So these are 20, and one more we have added here, 30th, which is congenital hypothyroidism, sickle cell anemia, and beta thalassemia optional. So we have 30 diseases which is a part of RBSK program. So what is done? The team of RBSK under this 4Ds, defect at birth, deficiency, diseases and developmental delay, try to screen children from birth till 18 years. So this, and if you remember in AIMS PG, they have asked this question, so it's very important. 30 diseases. Okay, let's take the next question. National Iron Plus Initiative is an example of primordial prevention, primary prevention, secondary prevention, tertiary prevention. Student, try. A very good evening to everyone. Try this question. So when you are giving iron folic acid, so what is this National Iron Plus Initiative? What do you think? Is it primordial prevention? Is it primary prevention? Is it secondary prevention? Is it tertiary prevention? Try this, students. Yeah, Sudhanshu goes with primary. Yeah, okay. I think majority of you have got it right. Yes. Simple, students. These 4 concepts, no? It's one-liner concept. What is primordial prevention? I say in one line, prevention of emergence of risk factors. Don't let the risk factor to emerge. When you are not surrounded by the risk factors, you will not develop disease. So that is primordial prevention. Primary prevention is you take actions before the disease onset. So you are surrounded by the risk factors. The risk factors are there, but you are trying to ensure that you don't get that disease by health promotion, specific protection. Now this is an example. A woman can suffer from anemia. So, or it is expected that she may suffer from anemia. So why not do a specific protection? Let's give a pregnant lady iron and folic acid. So what are you doing? You are giving iron and folic acid specifically to protect against anemia. So it is a classic example of specific protection which becomes a part of primary prevention. Now secondary prevention, what do you want? The disease has entered inside human beings. So what is the next step? The next step is diagnose the disease at the earliest, so you can treat it. So that is secondary prevention, and screening helps us a lot. And then there is tertiary prevention, where you are trying to limit the disability or rehabilitation. So in this question, iron and folic acid when you are giving, so it is a classic example of primary prevention. Okay. Great. Now, just for use now, the program where you must have heard Anemia Mukt Bharat, AMB. It is intensified iron plus initiative. It is based on 6 into 6 strategy, students. You have 6 beneficiaries, 6 interventions, and 6 institutional mechanism, right? So it is called 6 into 6 into 6 strategy. When I say 6 into 6 into 6 strategy, so you see who are the 6 beneficiary: children in the age group of 6 to 59 months, 5 to 11, 12 to 12 to 14 months, non-pregnant, pregnant, and men also. So these are the things and the beneficiaries. These are the levels of hemoglobin concentration. But let me come to the specific of 6 beneficiary where we are focusing. And this is a very important slide to understand, student. We don't need to remember the values, but you will be able to answer it without remembering the values, students. I'll give you an example. What is shown in the picture? It is NFHS4 data of anemia in different categories. If you see children, boys, girls, women of reproductive age group, pregnant women, lactating women, right? We have 6 beneficiaries. If you don't remember any value, just say one line: the prevalence of anemia in all age group is more than 50% except boys in the age group of 15 to 19. So can we remember this line? It's easy to remember. Prevalence of anemia in all the age group, you see 58, 54, 53, 50, 57. So it is more than 50 or more than 50. So that is one line, help us to remember the prevalence of anemia in different beneficiaries. Now what is the target government of India wants to reduce? So you see 40, 11, 36. Don't remember, students, it is 3% per annum. And in 6 years it is 18%. So by 2022 we will be reducing by 18%. 3% per annum, 6 years it becomes 18%. This much if you remember. Okay. Okay, I have seen Rajesh has answered a question, but definitely I'll answer your question, Rajesh. And before this, let me explain this. What I am saying, NFHS4 data, and Rajesh, this answers your question also. You see what is the prevalence of anemia in children? It is 58.4. What is the simple meaning of this? The simple meaning of this, out of 158 children are anemic. So how it is primordial prevention, Rajesh, now? How it is primordial? So when there is a prevalence, 58 with NFHS4 data says, it means children are surrounded by the risk factors. So you have to protect. So we are giving iron and folic acid. So it cannot be primordial. Primordial is, for example, a 5-year-old kid is not smoking. So you are telling, or 10-year-old kid, you are telling that the harmful effect of smoking, harmful effect of junk food, which they are not habituated. So the risk factors are not there, and you are preventing the emergence of risk factor. But children, you see the prevalence 58.4, it indicates that risk factors were there. So that was the reason 58% of the children are suffering from anemia. So risk factors were there. So when you are giving iron folic acid as a prophylactic measure, it is a classic example of primary prevention. Yes, Rajesh, I said, and what I am trying to focus on this slide, you don't have to remember the numbers. Don't remember, it's very easy. Or you see the different beneficiary. Prevalence is more than 50% in all categories. And the government of India, every year, they want to reduce by 3% per annum. So that comes to 18% in 6 years. You see, if you subtract here 58.4 and 40.4, it is 18. If you 29.1, 11.1, it is 18. Similarly, everything, it is 18, 18, 18. So the best way of remembering is 3% per annum. Okay. Now, so we have 6 interventions. I said Anemia Mukt Bharat works on 6 into 6 into 6 strategy, 6 beneficiary, 6 interventions. Interventions, what we are doing, students, we are trying to give IFA, deworming, behavioral change campaign, point of care treatment and identification of anemia, fortified food, iron folic acid fortified food, and also address the non-nutritional cause. So these are the 6 interventions which the government of India is pushing for reducing the anemia. So we have 6 institutional mechanism coming. We have different. It's not only the job of health department, the education department, the social welfare department. All will come together and try to work on reducing the burden of anemia. If you see this is important because they have asked question on this. Anemia Mukt Bharat, 6 to 59 years old age, we give 20 and 100 microgram of folic acid. It is bi-weekly, students. 5 to 9 years, 45 and 400 microgram weekly. It is a pink colored tablet. So color coding has been also done so that our health worker understand. So pink colored tablet goes to 5 to 19 years children. 10 to 19 year adolescent, 60, 500. It is blue color. It goes to adolescent. Non-pregnant, non-lactating, dose is same. It is red color. It goes weekly. And pregnant and lactating mother, you give daily, and it is also a red color. Okay. Yes, trust mine. So this is the dose of iron and folic acid I have mentioned for you. So it's very easy to remember. 20, 100 for children, 45, 400 for 5 to 9 years. Adolescent, non-pregnant, pregnant and lactating, all is same. 60, 500, 60, 500. The difference is in pregnant and lactating mother, we are going to give daily, and now the concept is to give minimum 180 days during pregnancy and also 180 days after pregnancy, means during lactation period also. So we are giving 180 days during pregnancy and 180 days during lactation. Okay. Bi-weekly means twice a week. Okay. Yes. And we are also in deworming also. So deworming, if the child is 12 to 24 months, we give half tablet. If it is more than, then we go with 1 tablet. And then 1 tablet, and it is by annum deworming has to be done. The only thing which we have to remember, in pregnant women, we go only in 2nd trimester. So this is about Anemia Mukt Bharat. It is also called Intensified Iron Plus, National Iron Plus Initiative. Okay. Now let's go to the next question. Let's be fast. On World Polio Day 2019, students, while polio virus type dash was declared eradicated, is it type 1, is it type 2, is it type 3, or is it type 1 and type 3? Try this. Gaurav goes with type 2. Okay. Indrani goes with type 2. No, but Sudhanshu goes with type 3. Very good. Sudhanshu goes with type 3. Rajesh also goes with type 3. So there is a confusion between B and C. Now, students, type 2 was already declared as eradicated. Type 2, while, mark my words, I am not saying poliomyelitis is eradicated. That is a disease. I am saying while polio virus type 2 was eradicated in 2015 only. Right? So there is the question is asking about 2019. So type 2 was already eradicated. In 2019, we eradicated type 3. Type 3 wild polio virus. I am not saying about disease. We still have type 1, which is circulating in Pakistan and Afghanistan. It is still there. So whenever such question comes, don't presume that the disease is eradicated, because disease can happen due to type 1 also, and there is also a possibility of disease, poliomyelitis disease, due to vaccine derived polio virus and vaccine associated paralytic polio. So we will not say that the disease has eradicated, but we will definitely say that while polio virus type 2 was eradicated in 2015, now in 2019 On 24th October, which is World Polio Day every year, 2000 last year, type 3 was declared eradicated. Okay. Now let's do, so this I've discussed. Let's do the next question. An initiative for zero preventable maternal and newborn death is. It is Surakshit Matritva Aswasan, RMNCH, RCH, CSSM. Try this, students. What do you think? Mahesh goes with A. Parag goes with A. Very good. Indrani goes with A. Mahesh, Sudhanshu. Yeah. No RMNCH, Sudhanshu, Gaurav. Initiative of the only catch is zero preventable maternal and newborn deaths. So already the government of India has got a flagship program called RMNCH plus A. So it is already going on. Under this there are n number of programs related to reproductive, maternal, newborn, child health and adolescent for sure. Now in 2019 we had this Surakshit Matritva Aswasan, which is Suman. So this is what new thing Suman brings as far as when you compare with RMNCH. It is saying that let's avoid preventable maternal and newborn deaths. So it should be zero. How do you do that? So you implement RMNCHA in best of the capacity first, and second, there should be grievances redressal mechanism. So any issues which has been identified need to be addressed. Plus there is a maternal death, child death review mechanism. So that strengthens why there was death, what was the reason, this could have been avoided. So this is basically we are trying, and you know what is the maternal mortality ratio of India as of now? It is 113 students. National health policy says that we want to come to 100. SDG says we should come to less than 70. So how will you ensure these targets? Unless and until you don't come with some innovative ideas, certain things which are not functioning properly, like suppose there is a grievance, so a pregnant lady goes and the services has not been provided to her optimally, she can complain, so an action can be taken. So a grievances redressal mechanism is placed. Maternal deaths or child death, if it is happening, so let's have a review mechanism, so that an stringent review mechanism, so that we can address or plug the holes wherever the loop is. So this Suman coming in is ensuring that let's have zero preventable maternal newborn death. And 100, the target I am saying 113 is of India maternal mortality ratio now. National health policy says 100, SDG says less than 70. Okay. Right. Now, under 5 mortality rate of India as of now, what is that? Under 5 mortality rate of India is what as of now? Jalina goes with A. Okay. Parag goes with D. Rajesh goes with 37A. Sudhanshu goes with D, not sure. Okay. Now, students 37, if this question I would have asked 3 months before, I would have thought that you are right. But now you are wrong. The answer is 36 per 1000 live birth. Yes, Kishore is absolutely right. Sonam is right. It is 36 per 1000 live birth. So this is the correct answer. Okay. There are many things, students. Take few questions. Then we'll discuss on this. What is the sex ratio of India currently? It is 899, 896, 943, 914. Try this. Abhishek, Kishore, Sonam, Sudhanshu, Gaurav. Yes, value has changed. What is the answer to this, Rajesh? Somebody saying C, D, 9 and 14. No, 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 no. Yeah, no, Parag, no, wrong. It is 899. No, Rajesh, it is 899. But you were very near. It was 896, absolutely correct. But now SRS 2018 data we have, that says it is 899. It has increased from here to there. Yes, go with 899 now. Okay, first take few questions so that you are updated with this latest data. State with highest sex ratio is Kerala, Chhattisgarh, Tamil Nadu, Manipur. Try this. Thayam goes with B. Gaurav goes with A. Kerala, yes. Kerala, no students, no. State with highest sex ratio now, if you ask, it is Chhattisgarh. It has surpassed slight, means Chhattisgarh has got highest sex ratio now. This is the catch. This was not easy question, because the moment highest sex ratio comes, everyone thinks about Kerala. But you see, now the data says it is Chhattisgarh. First, let's go with the second one. Take few more. State with lowest sex ratio in India. Is it Haryana, Punjab, Rajasthan, Uttarakhand? Try this. Punjab, somebody is saying Haryana. Try. Gaurav says Haryana. Majority of you is Punjab, Haryana. Yeah, somebody said, Kishore says D. Kishore says D. Parag also says D. Yes. State with lowest sex ratio is Uttarakhand students now. It's not Haryana. So normally we tend to answer the moment we come to such questions, the lowest sex ratio, we think of Haryana. But now it is Uttarakhand, please remember. Okay. Now this is a slide, updated one, SRS 2018 data. Under 5 mortality 36, infant mortality 32, neonatal mortality 23, early neonatal mortality 18, late neonatal mortality 6, perinatal, post-neonatal mortality 9, perinatal 22 and stillbirth 4. Now how do you understand, how do you remember this? That's the most important point. Now, many of you were saying that under 5 mortality is 37. So 37 was in 2017 data. Now 2018 data says it has come down with 1. So it is 36. So 36 under 5 mortality per 1000 live birth. Out of this 36 students, 32 are infants. Out of this 36 only, 32 are infants mortality. Now out of this 32, 23 is my neonatal mortality. The moment 23 is my neonatal mortality, so if I subtract from 32, 23, it becomes 9. What is 9 then? It is post-neonatal mortality. Simple. Now when we have this 23 as neonatal mortality, so first 7 days, which is early neonatal mortality, that is 18. And late neonatal, which is 7 to 28 days, is 6. So it becomes 24. It is in round figure, so it is 24, but the value is 23. So this 2 makes to this. Now post-neonatal mortality, I have already said it is 9. Stillbirth is 4. And your early neonatal mortality is 18. If you add 18 and 4, it becomes 22. Simple, no? So if I start writing here, it is 36. Out of this 36, 32 are infant deaths. Out of this 32, 23 are neonatal deaths. Out of this 23, 18 is early neonatal death and 6 is late neonatal death. And from 32, if you subtract 23, it becomes 9. That is post-neonatal mortality. Stillbirth is 4. Perinatal becomes stillbirth plus early neonatal, so it becomes 22. So always think in this way. You will never be wrong. Now suppose 2019 data comes, for example. It will come down from 36 only to 35, 34, whatever. From 32, 31, 32 like this. So this is the way you remember such data, and you know when SRS 2018, so it will be easy for you to remember SRS 2019. Now, this was the catch. Under 5 mortality, 36 is the national data. The state which tops the chart is Madhya Pradesh, and bottom we have Kerala. Correct? Infant mortality 32, MP tops the chart, Kerala is at the bottom. Neonatal mortality 23, MP tops Kerala. So if you see first 4 data, we don't have to be much worried. MP is at the top and Kerala is at the bottom. Now the problem was with stillbirth. 4 is the national rate, Odisha is at the top, and Jammu Kashmir and Jharkhand is at the bottom. Perinatal mortality rate, you see 22 is the national data, Odisha at top, Kerala at the bottom. Now this was the catch, students. Sex ratio, the value is 899. Chhattisgarh is at the top and Uttarakhand is at the bottom. So please, whenever such sex ratio question comes, so normally we have a tendency to put Kerala and the bottom we put Haryana. No, yeah, Kerala is not very far, but Chhattisgarh has got an added advantage now. So whenever such questions comes, please answer Chhattisgarh and bottom will be Uttarakhand. Okay. Now let's take the next question. Under Free Diagnostic Service Initiative of National Health Mission, how many tests are available at PHC? It is 9, 19, 57 and 18. Try this. The Government of India is under Free Diagnostic, Free Drug Initiative. They are ensuring that how many tests can be done free at PHC, free at CHC, District Hospital, Sub-Center. So Parag goes with B, Rajesh goes with 9, Varuna goes with 19, Parag goes with 19, yes. Anyone else? Yes. Now, what is important? A free diagnostic initiative means what are the tests which you will be providing to the people in free by the different healthcare delivery system. So PHC, the answer is 19. It is B. Now how it becomes easy to remember, students? See. So let's start from the bottom. So at the bottom we have sub-center which caters 5,000 population. So at the sub-center we may provide 9 tests, diagnostic tests. At the PHC we will provide 90. At the CHC we will provide 39 tests. And at the subdivisional hospital and district hospital we will provide 57. So it becomes 9, 19, 39 and 57. Whenever you go to a PHC, sub-center or a district hospital, students, you will see wall painting or hoardings where you will see these are the tests which can be done free. 9 at sub-center, 19 at PHC, 39 at CHC and 57 at subdivisional and district hospital. So this is under Free Diagnostic Service Initiative. Okay. Let's take the next question, the easy one. Which of the following is not the work responsibility of ASHA? Simple one, students. I think everyone can answer this. Immunization and contraceptive counseling, delivery at home, provide medical care for minor ailment, promote constructions of household toilet. Try this. Yes, this is the easy. No, why D? Which of the following is not the work? Immunization and contraceptive counseling. Yes, this is the work of ASHA. Medical care for minor ailment. Yes. They also promote construction of household toilet. This is also correct. They cannot conduct delivery at home. They are not that expert. Yes, they cannot conduct. They can counsel. They can take that counsel for institutional delivery. They can accompany her, the pregnant lady, and all those things she can do. But she cannot conduct delivery. So this is not the job of ASHA. Okay. So I'll stop here, students. Thank you for watching and thank you for joining. I'll take more questions next week. I am again planning for National Health Program Part 2 and I request you all to join. So I hope these sessions are helping you out. Yes, and definitely National Health Program, it has to be updated. You have to be, means because many programs comes and which is focusing primarily on RM and CHA. Then you have non-communicable disease, communicable disease. So it's become quite important for us to be very prompt in national health programs and the indicators so that we answer those questions correctly. So with that note, students, thank you very much for watching. Take care. Good night.